Our primary mission in the Department of Neurological Surgery at UT Southwestern Medical Center is to deliver the best possible patient care. Clinical work is our foundation, and upon that foundation, we are building an outstanding academic program to develop the future therapies that will enhance the lives of the patients that we take care of. That really means partnering with basic scientists, with translational neuroscientists, and with an array of people that are supported through our O'Donnell Brain Institute to be innovative and provide breakthrough technologies.
UT Southwestern is the sole academic medical center in a metropolitan area of almost 7.5 million people. Has a long-standing reputation for excellence in basic medical science and a recent dedication to excellence in the provision of clinical care. It has 4 outstanding hospitals, Clemens University Hospital, and then the massive Parkland Hospital Children's Medical Center, which is internationally known, and then Dallas VA Medical Center, which is a stable, solid VA facility.
Our programs really develop around a patient-centered model. We're really focused on building out those programs with expertise across the different departments.
UT Southwestern has a comprehensive brain tumor program that really incorporates excellent clinical care with academic pursuits and education. We have fellowship programs in skull-based surgery as well as in medical neuro-oncology. And we have an active academic pursuit with respect to research. Our particular academic strengths are in brain tumor metabolism and advanced imaging. The backbone of the UT Southwestern Neurosurgery program has always been and likely will always be one of technical excellence, exceptional patient care, and treating the operating room with utmost respect. What I've seen evolve and change over the years is an increased emphasis on the quality of patient care and the patient experience, and certainly a true expansion in the academic and research pursuits. UT Southwestern has always had a very strong research backbone, and I think neurosurgery has really tapped into that in the last 10 years, and I expect that to increase over the coming decades. This institution is dynamic. It really feels like a place that you could make your mark.
Functional neurosurgery sits at a nexus between clinical care, basic science, and translational efforts. Functional neurosurgery at UT Southwestern includes epilepsy surgery, movement disorders, treatment of pain, and then more emerging indications like deep brain stimulation for affective disorders and brain-computer interface devices for motor restoration. The first thing that drew me to UT Southwestern is, of course, the top-notch reputation for clinical excellence among the surgeons who work here, and also in training the next generation of neurosurgeons. Another unique aspect is our partnership with Parkland Hospital. So Parkland is an indigent care county health system here in Dallas. Our surgeons work in partnership with the neurology doctors who cover both hospitals to make sure that those patients have access to the same types of therapies. I've certainly seen a lot of important investments made by the institution to augment functional neurosurgery. One good example is the MEG program, and that's really been a boon to our epilepsy surgical program and also a nice tool for translational research. With the investment in the O'Donnell Brain Institute, there's been a concerted effort to develop expertise and assistance in more complicated regulatory matters, and that's an important factor that helps augment the kind of new therapies that can come out of the functional division here.
As of 2014, we became a much more integral part of the UT Southwestern Neurosurgical Group, and we now are a total of 6 pediatric neurosurgeons. I came down for the fellowship. They offered me a position to stay, and all of this positive environment with the innovative technologies that we have available to us, as well as the diversity, just made it an opportunity that I had to take. We have a large population that we serve with very diverse neurosurgical pediatric problems that we're able to treat. There is such a team collaboration. We discuss the cases for the next day, we support each other. There's so much innovation that is going on, and with the neuromodulation, in the past 10 years, we've seen laser ablation come in, and I'm able to treat small brain tumors. I'm able to treat focal areas of the brain where epilepsy is coming from, and I can help these children out. Having AI and being able to understand these networks in a 3D fashion, this is only going to build and grow, and we're going to become better as time gets on.
Our spine program is a combination of all of the different specialties that take care of spine patients. Neurosurgery, orthopedic surgery, physical medicine and rehab, as well as pain management. We work in an integrated multidisciplinary team around the patient to help manage patients with spine-related disorders. Collaboration and the interdisciplinary approach is really what excites me, and really thinking novelly about how we manage and treat patients today and what's coming in the future and being a part of that. In the last several years at UT Southwestern, it's really been a metamorphosis for our program and really growing in directions that are new and novel for us, really maintaining that lead position in neurosurgery here in Dallas and also around the country. And being a part of a team that's doing really great things, whether it's my colleagues in neurosurgery and oncology or functional or pediatrics, it's really about being a part of a great team.
UT Southwestern was one of the first programs to really embrace endovascular aspects of cerebral vascular disease. Since 1995, we've had a dual-trained neurosurgeon here. What has really continued to grow is that evolution of not only treating patients surgically, but treating patients endovascularly. And with the development of the new facilities that we have at UT Southwestern, we're now even taking surgical approaches to endovascular disease very seriously. We pride ourselves on being able to manage all aspects of cerebral vascular disease, which also includes radiosurgery. We also work very closely with the cerebral vascular group, which is radiologists and neurologists that have varying specialties and interests. When we take care of patients, they're both acute emergencies, which are stroke, but also life-altering diagnoses like aneurysms and arteriovenous malformations. We've been able to develop a very significant practice in the treatment of moyamoya disease also.
What sets us apart at UT Southwestern Medical Center is the spirit and focus on collaboration. We have amazing leaders that are focused on creating synergies that will maximize our impact. We really are working together to create new ideas and pave new paths that will enhance the future of our faculty, our patients, and our trainees.
UT Southwestern and Texas have both been, in many ways, sleeping giants for a long time. There is an enormous boost in energy and investment and enthusiasm, both on the statewide basis in terms of our economy and our population growth, but also at UT Southwestern in terms of our expansion broadly across all areas of biomedical and clinical science.
With the Metroplex, there's been a lot of financial support. There's a lot of other types of support that help us thrive and deliver back to the community the care that they desire.
Once you set foot in these buildings, you'll realize what kind of a community this is.
One of the best tips I got when I was on the interview trail was that you should look where there's construction and where there's growth. And that means they're focused on helping you. And I mean, it's so clear when you look around Southwestern, and the same thing goes with Dallas, it's just booming.
The growth of Dallas and the diversity of Dallas is an asset for our program. It makes your head spin how rapidly it's growing, how many new people are moving here, how many diverse people from all around the country and all around the world are moving here and relocating to Dallas.
I feel like there's so much variety here in Dallas that you can't get in any other place. I'm never bored here. You know, there's always something to do.
I've been out to Fort Worth a couple times. We'll do the museums out there, or the stockyards are great.
Dallas has a lot of restaurants. If you're interested in the nightlife, Uptown and Deep Ellum are a couple of places to go, and they're just within a 15-minute radius.
What's so beautiful about Dallas is that there is so much green space. Clyde Wharton Park is a great place to get outside, but there's also White Rock Lake where you can go running and walking around.
I've been able to really start a life here with my husband. We just bought a house. I think the city is still growing, and of course, I want his job opportunities to be great too.
This is an easy place for a busy surgeon, clinician, scientist to find work-life balance and a lot of culture with the warmth and friendliness that is unique to Texas.
There's a lot of educated people here, young professionals. A lot of people just want to do great things.
Dallas is a very cosmopolitan place and it keeps growing. When you come to Dallas, you should expect to see people from all walks of life and see interaction with people from all cultures. So that really makes it a very attractive place to be and practice and care for people.
Southwestern has such a low rate of tuition. It's probably one of the lowest in the country. And beyond that, the cost of living in Dallas is so affordable.
Our stipend is pretty competitive as graduate students, so I'm able to really enjoy a lot. We've hosted so many barbecues and fish fries and parties at our place.
That's what I enjoy most about UT Southwestern is that close-knit family bond that you are able to create here. This has become home for me, and I'm very, very grateful for being here in the city and also being here at this institution.
Dallas has been at the forefront of technological innovation for a long time. It creates an opportunity to bring smart people from different disciplines together, and I feel like Dallas is right at that point.
One of our key values is to train the future of neurosurgery. What we really want to see in our team are people who are devoted and focused on making sure that our trainees are successful. Part of that success is understanding each trainee and understanding where they want to go with their career and what questions they want to ask and how they want to be impactful in their career. We are focused on making sure that our trainees are the most technically gifted and clinically advanced neurosurgeons of the future.
UT Southwestern is an institution in evolution. It's an institution that constantly challenges itself and wants to be dynamic, be better for the end goal of improving human lives, improving patient care.
UT Southwestern as an institution has punched above its weight for a long time, both on the research side and on the side of clinical care. And now with the rapid growth in the metropolitan area, the support of the institution, things like the O'Donnell Brain Institute, Nobel Prize winners, and on the side of clinical care with the excellent reputation we've established. We're building on our strong reputation and the institutional knowledge for exceptional clinical care, resident training, and applying that same level of attention to detail and rigor to the sort of research that's coming out of our institution. I expect UT Southwestern will continue to punch above its weight, but it'll just be a much bigger weight to start with.
Most people know the Department of Neurosurgery at UT Southwestern Medical Center for its clinical excellence and innovation. We're not done innovating. We continue to brainstorm, work together, collaborate, and synergize across all areas of medicine, but in particular within clinical neurosciences through our O'Donnell Brain Institute to create the future, whether it's for our patients, it's for our trainees, or for science.